Across the globe, a familiar sense of unease is settling in as we hear reports of a new viral outbreak. The news is spreading rapidly, capturing the attention of people worldwide. This time, the epicenter is China, a country with a dense population and bustling cities, where hospitals are seeing a surge of patients, overwhelming the healthcare system. Many of them are children, struggling with a respiratory illness that has left parents and doctors deeply concerned. Social media is abuzz with images of crowded emergency rooms, and the public is sharing their fears and experiences online. Concerned citizens are discussing the outbreak in public places and on various digital platforms. While the situation is undoubtedly concerning, it's crucial to stay informed and calm. It's important to approach it with a balanced perspective, armed with accurate information. This isn't another COVID-19, but a virus known as human metapneumovirus, or HMPV. This virus, while serious, is not entirely new to the medical community. While not new to the medical community, its recent surge has placed it squarely in the spotlight, demanding immediate attention. Prompting news conferences and public health announcements. The outbreak serves as a stark reminder of the interconnectedness of global health and the importance of proactive healthcare measures. Proactive healthcare measures are essential to prevent the spread of such viruses. As we navigate this evolving situation, understanding HMPV is crucial. Staying informed and following health guidelines can help us manage this outbreak effectively. First identified in 2001, HMPV, or human metapneumovirus, has been a subject of extensive research ever since. HMPV is a respiratory virus that primarily affects the lungs and airways. Despite its prevalence, it often flies under the radar, making it less known to the general public. It's part of the same family as the more well-known respiratory syncytial virus, or RSV, which also causes respiratory infections. Like many viruses, HMPV spreads through respiratory droplets released when an infected person coughs or sneezes, making it highly contagious. These droplets can then infect others directly or contaminate surfaces, leading to indirect transmission through touch. HMPV is a common cause of respiratory infections, particularly in young children who are more susceptible to severe symptoms. In fact, most of us have likely been infected with HMPV by the time we reach adulthood, often without even realizing it. However, this doesn't mean it's harmless. The virus can still pose significant health risks. For some, particularly infants, older adults, and those with weakened immune systems, the infection can be more severe. HMPV can lead to serious complications, requiring intensive medical care and sometimes even hospitalization. HMPV typically announces itself with symptoms that mimic the common cold, making it hard to distinguish from other respiratory infections. Think coughing, runny nose, sore throat, and fever. These symptoms are common and can often be managed at home with rest and fluids. However, in vulnerable individuals, it can escalate to more serious conditions like bronchitis or pneumonia, requiring medical intervention. Infants, especially premature babies, are at increased risk of developing bronchiolitis, an inflammation of the small airways in the lungs, which can make breathing difficult and may necessitate hospitalization. HMPV spreads through close contact with infected individuals or contaminated surfaces, making it highly contagious in crowded places. This is why simple hygiene practices such as regular hand washing and using hand sanitizer are so crucial in preventing its spread. Frequent hand washing, covering your mouth and nose when coughing or sneezing, and avoiding close contact with sick individuals can significantly reduce transmission. These measures are simple yet effective in keeping you and your loved ones safe. While news of another viral outbreak can be unsettling, remember that knowledge is power. By understanding how HMPV spreads and taking simple precautions, we can protect ourselves and our communities. Practice good hand hygiene by washing your hands frequently with soap and water or using an alcohol-based hand sanitizer. Avoid close contact with sick individuals and disinfect frequently touched surfaces. If you experience symptoms of a respiratory illness, stay home to prevent further spread. While there is currently no vaccine for HMPV, researchers are actively exploring potential vaccine candidates.